All right, so at this point, we just finished wiping the patient's mouth. Now we're at the very end of procedure. So the first thing we're gonna do is remove, remove, move. Now when removing these obstructions, the first remove, you're gonna never walk behind the patient. So you're gonna walk around and go from here. I like to keep my hands up so I don't touch anything that's not barriered. It's very important to only touch things that have a barrier on it. You're never gonna touch the actual arm of anything like that. So you can bring the light first, just grabbing by the barrier, into the hallway. Additionally, you're gonna grab the doctor's side. With this, I like to hold my hand here on the right side, and then make sure you're just pressing where the air goes again. If your hoses have to get caught up, just ask permission to adjust from there, say infection control, and we can adjust it from there. Once you're here, you're on your second remove. So we just removed the obstructions, our first one. Our next thing to do is to remove the burrs. You're gonna remove the burrs like so. Place them back in the DAPN dish. So far we've done remove, remove. Now we're gonna move. So we're already here, just do everything while you're actually on the doctor's side. Remove, remove, move. You're moving them downward and forward. Okay, now that the patient is sitting up, and to not forget about these things here, you can grab them. But with this, we can walk around the opposite way we came instead. Grab all your items here. Keep the hand pieces and the three-way syringe there though. Grab this and throw it in the back. We've just performed remove, remove, move. Now, we're doing triple D. Disassemble, dispose, dispose. The first thing is to fully disassemble the syringe. Remember our acronyms here. We have FIFO. The first in, first out. The first thing we put in there was the carpule, and then we put on the needle. So the first thing you're gonna do is disengage the harpoon from the rubber stopper. Once doing so, take out the carpule and set it on your tray. You need to fully disassemble the syringe before disposing of any sharps. Then push the harpoon back in. At this point, you're gonna be doing palm to palm. When doing palm to palm, make sure your palms are actually palm to palm, and you can use the tray to help you for stability. Once the needle is off the aspirating syringe, put the aspirating syringe down. Immediately dispose of that needle that's in your hand. Do not put it back on your tray. Once there, you can use your elbow to close the sharp container. Now, we have 4 total sharps. That was one of them. We have 3 more. Next thing we have is the carpule itself, the matrix band, and then lastly, it's the acid etch tip. So far we have disassembled and disposed of the sharps. The next thing to dispose of is going to be the scrap amalgam. Now with this, once you pick it up, it needs to go on your tray and you cannot move it from that point. So you're going to pick up the scrap amalgam container and place it on your tray. Once it's there, it cannot move again. You will then open this. There are going to be 3 things to dispose of. The first thing is going to be the capsule itself from the amalgam. Next is all the remnants that's inside of the amalgam well. Lastly, it's going to be both sides of the amalgam carrier. Even if you only use one side, you need to dispense both sides so nothing's stuck in there. Those are our 3 things to dispose of for the amalgam. Then you're going to keep this there and put the lid back on. At this point, you're going to place everything on your tray itself. So all this stuff here needs to go on your tray. Once all that is there, you're going to grab the patient glasses. Now typically, a patient's going to hand you their glasses, but in this scenario, you're going to pick up the glasses off their face, like so, and place them on the tray. Then, grab the patient napkin with the towel chain and pull it off from there. Once you place it on the tray itself, it's going to be placed shiny side up. At this point, it is very important to make sure before dismissing your patient, you need to take off your PPE. Now when taking off your PPE, you're first going to remove your gloves, then your mask, and you're going to wash. You never leave your DTR with your PPE on. So once again, I'm taking off my gloves first, my mask, and then I'm going to perform hand hygiene. After that, you're going to dismiss your patient. The first thing to dismiss them is going to be the armrest. They need to be able to get out of the chair. Armrest, and then you say, have a nice day. And by saying that, you're going to drop the head down like so. After that, once they're gone out of the room, you're going to open your Dipsy bin, only touching the outside of it. And then you're going to finish up with your charting. All right, we are on our very last step of doing the admin work. So earlier in initial charting, we charted in everything item 9 in pencil. So now that we've completed the treatment, the first step is to first annotate what you did in here, and now restorations and treatments in item 8 that's completed during service. So number 2, MO was an amalgam restoration. So I have number 2, MO. This is in pen at this point. Being amalgam, it's going to be fully darkened in. Now, for number 8, facial, that was a composite restoration. So in item 8, just like it is in item 4, it's going to be an open circle that's not darkened in because it's a composite restoration like so. Once you annotate, when you switch it from 9 to 8, now you're going to erase it in item 9 because it's no longer needed to be done at that point. Once erased, then you're going to transcribe in item 10. So today's date. Now, the first thing we did was number 2, MO, amalgam restoration. You need to annotate everything here. So number 2, the tooth number. The surface was MO. The type of restoration was amalgam restoration. Additionally, we did number 8, facial composite restoration. So we have tooth number 8. The tooth number, the surface was facial, and then the type of restoration was composite restoration. Then I'm going to put underneath that my name as the assistant, 2 spaces, and the doctor's for the signature. At this point, you're going to ask the doctor what class the patient is in.
Patient has no further treatment needs.
Considering that there's no further treatment, that's going to be class 1. You're going to put that on the same line as the doctor's printed name. In this open space, you're going to ask the doctor to sign prior to filing the record. That is the last step. Would you mind signing this, please?
Looks good.
After the signature is completed, you're going to file the record. Now this is a 40. So first we're going to go to the 40s. We're going to look through the records. So my number is 6940. This one, next one up is going to be 9340. So therefore 69 is less than 93. Once filing it, keep it sticking out for the instructor to evaluate from there. You are all done.
Yay!